Hi guys, my name is Jacob Allard, and we're going to be talking about my current event today that has to do with healthcare incentives program. And this article was found on healthcareinformatics.com, which is a website that provides articles and journals about healthcare informatics. Specifically, this article was written by Leventhal, Raheen, and the title was Promoting Intraoperability and Finalizing the Rule, which occurred on August 2nd, 2018. So before we get into that, I want to talk a little bit about who created the incentives program, and that is going to be the CMS, or the Center for Medicare and Medicaid Services. And basically, this is a federal agency in the United States that's responsible for providing health insurance and portability standards. They're also responsible for other things, but these are the two I'm going to mention right now. And basically, the importance of health incentives, which was outlined in the HITECH Act, which kind of began in 2014 when President Bush required that all patients had electronic health records, and then President Obama kind of pushed this into play. Basically, that was to promote change in healthcare delivery, promote change in the quality and the cost of healthcare in the United States. And basically, financial incentives were given to providers who adopted and implemented a meaningful use of a certified EHR, electronic health record. And what I mean by meaningful use was a set of standards they met that the government came up with in order to be certified. So in order to meet standards to become a meaningful user, you had to meet 5 initiatives, and then they must be reported on to the government to determine if they were the 5 initiatives were met or not. So the criteria includes improving quality, efficiencies, and safety, engaging patients and their families in care, improving coordination of care, improving public health, and ensuring adequate privacy as well for patients' health information. Basically, to meet those MU standards, there were 3 stages of reporting that the government came up with in order to have the reporting be structured and force providers to give correct reporting in order for the government to determine whether these providers or organizations were meaningful users of their EHR system. Okay, so my article begins and was written on August 2nd, 2018, and basically the Center for Medicare and Medicaid Services finalized a rule that promoted interoperability, excuse me if I'm saying that wrong. And this was a core initiative in stage 3 of the meaningful use reporting, and it emphasized the exchange of patient health care information by providers in order to improve the quality of patient care overall. And basically, the rule that was finalized by the CMS gave a 90-day reporting period for the 2019 and 2020 period. But not just this, it also required that providers who were trying to become a meaningful user, they used a 2015 EHR or better. And that would begin in 2019, that 2015 or better EHR system would be required, okay? Basically, finalizing of this rule, making updates to it, the 90-day reporting period, it would change Medicare payment policies and rates under the inpatient prospective payment system, and then long-term care hospital prospective payment system as well. So these would all be altered just a little bit as far as the reporting standards and what they needed to report. And that would apply to about 3,300 acute care hospitals and about 420 long-term care facilities. And this would all begin on October 1st, 2018. And the main goal of finalizing this goal and kind of changing it up a little bit was to promote sharing of healthcare data between providers, patients, and insurance companies, okay? And then CMS is also, they made changes to the EHR incentives program as well, not just to increase the interoperability or exchange of data, but to also decrease the burden on providers for reporting the specific MU standards. So they really went through the MU standards, and the ones they believed did not support interoperability or exchange of patient healthcare information, they took out and they revised them. And this is super important for us nurses, they have implications on all healthcare providers, but nurses and nurse practitioners in general, because we as nurses want to give high quality care to every patient we see. In order to do this, we need a team of professionals working to change the system, so that front of the line healthcare workers like us, nurse practitioners, PAs, doctors, can give that high quality care. Not only will having an EHR system and changing this rule to encourage sharing of clinical data increase care, but it will give a more well-rounded picture for patients that are coming to see us, especially with chronic diseases. We sometimes only see what's going on here and now, and not the whole picture. So being able to share data with other providers and backtrack information will help us provide a higher quality care. It'll help us plan better medications, routines, and overall coordination of care. So that's why this is important to me, especially as a future nurse practitioner. I want to know the whole picture, not just what's going on right now, okay? So if you have any questions, let me know. Thank you guys. Appreciate it.